I'm Dr. Shirley Hartman. I'm a family physician in Jacksonville, Florida, in one of the areas in which I specialize is in Lyme disease. So one of the things that I want to talk about is a protocol to treat Lyme and co-infections that anyone could do without having to have a prescription or a doctor, because a lot of people with Lyme are so ill that they can't really function and produce enough income. They may not have health insurance. And this is an inexpensive protocol that anyone and everyone can do. So the first thing that I have people start with is a baseline of support. So my favorite multivitamin is the Life Extension 2 per day. So that kind of covers the methylated vitamins.
Is it a multivitamin?
It's a multivitamin, but you get all kinds of minerals, zinc, vitamin D, B complex. So it covers the bases. I generally recommend that people take vitamin C because it's an antiviral and it's important for supporting the adrenals, which is always a problem in Lyme. Usually that's 1,000 milligrams 2 to 4 times a day. I typically have people take omega-3 for their omega-3 oils. 80% of the dry weight of an infant brain is omega-3 oil, so we need it for the structure and thus the function of our brain. We need it for every cell membrane in our body.
Times?
And it's anti-inflammatory. So my favorite omega-3 is a product called Core Omega, where it's in a packet, and that packet is the equivalent of 6 capsules a day. So generally 1 packet a day gives people enough omega-3 to get that anti-inflammatory effect.
Perfect.
So the next thing that I'll add in is liposomal glutathione.
Mm-hmm.
So I've been checking glutathione levels on patients for several years. And with our Lyme patients and people that are chronically ill, virtually all of them have very low glutathione levels. So the least expensive glutathione that I've been able to find is from a company called Boardroom Organics. So their product has 3,000 milligrams of liposomal glutathione. Most of the capsules have 250 to 375 milligrams per capsule. So a whole lot more. And a $60 jar gives you 57 servings of 3,000 milligrams. Nothing can compare with it. It tastes bad, but you can add it to orange juice and it works. So I typically have people take, 1, sometimes 2 tablespoons of liposomal glutathione a day, especially if they're doing any kind of active kill for Lyme disease. So glutathione is critical for being able to clear toxic load. So if you can't clear the toxic load from your mitochondria, you can't produce energy, you'll be tired, and it compromises really every function in your body. You can't detox. If you can't clear toxic load from your liver, you have a hard time being able to function because you're a toxic mess. If you can't clear toxic load from your immune system, then the immune system malfunctions. It cannot fight infections, and it's more likely to have autoimmune reactivity. If you can't clear the toxic load from the brain and the nerves, then you have malfunction of the nerves and neuropathy and numbness and tingling and problems with balance and dysautonomia and GI problems and brain fog and difficulty with focus, concentration, memory. So the other component of the glutathione that I really like is that the liposome is phosphatidylcholine. And you need phosphatidylcholine not only for the structure of the mitochondria, but you need it in order to rebuild the myelin insulation around the nerves. The nerves in the brain and in the remainder of the body, just like an electric cord, have insulation. And if that insulation is damaged, then the nerves and the brain can't transmit signals appropriately because you cut the insulation. So the wonderful thing about phosphatidylcholine is that it rebuilds that insulation around the nerves in the brain and peripherally, and then the nerves start working better. It also is important for the structure of the mitochondria. So the mitochondria start working better and people have more energy, and their brain works better because they have more mitochondria producing energy to fund their brain. Once I have people on a Life Extension Multi, Core omega for omega-3, vitamin C for adrenals and viral load, and glutathione to clear the toxic load and rebuild.
How long did you do this first part of the treatment?
Typically, we do a week or 2 weeks to get the support supplements added in.
Okay.
And then at whatever point someone feels ready, they can add in the next phase.
Okay.
Then I start them on a gentle support regimen that also has kill properties. So there have been articles published in the literature funded by Lyme advocacy groups looking at what herbals are effective for chronic persistent Lyme, chronic persistent Bartonella, and chronic persistent Babesia. So my favorite 3 herbals that work for Lyme, Bartonella, and Babesia are Cryptolepis, which gives you the best kill for every single one of them, Japanese knotweed, and Chinese skullcap. All 3 of them kill all 3 of the major Lyme co-infections. So I start with Chinese skullcap. And the reason for that is that Chinese skullcap is wonderful for helping anxiety, insomnia, joint pain, inflammation, histamine, mast cell activation. So you start people with like 1 capsule of Chinese skullcap at bedtime. And then after a couple days, you can take 1 in the morning, then 2 at bedtime, 2 in the morning. And I have some people that take as much as 3 capsules of Chinese skullcap 3 times a day because it will actually lower C-reactive protein, which is a laboratory marker of inflammation. It lowers interleukin-6 levels. So I love that people can start Chinese skullcap and they just feel better. So once I have someone worked up on the Chinese skullcap, then we add in Japanese knotweed. Now, and my favorite brand of Chinese skullcap that I use is from Swanson Vitamins. It's
Inexpensive.
$3 and some a bottle. So everybody can afford that Chinese skullcap. And there are other Chinese skullcaps out there. Maybe the Swanson brand isn't the epitome of excellence as an herbal, but it's definitely the most affordable. I know that even that inexpensive product works because I was having old lady arthritis, my fingers were hurting, and I added in the Chinese skullcap, gone within days. I was off it for a bit and my finger joints were beginning to hurt again. I restarted it, all gone. So even if it isn't the most expensive product, looks to me like it works. So once I have someone on Chinese skullcap, which is the best for calming all that inflammation and mess and relieving so many symptoms that Lyme patients have, then I'm ready to start Japanese knotweed. So my favorite brand of Japanese knotweed is actually resveratrol from Swanson Vitamins. So again, it's very affordable. I think you can get 2 bottles for $18 of the 250 milligram. I was taking the resveratrol myself, and I looked at the bottle and it said, extract of Polygonum cuspidatum. I'm like, that's Japanese knotweed. So, you don't have to pay $30 a bottle for Japanese knotweed because this stuff is about $9 a bottle. So we've used resveratrol for years in the treatment of attention deficit problems. And Japanese knotweed and resveratrol are highly anti-inflammatory. And it's one of the things that we'll use as a natural product for COVID to reduce inflammatory response. And it's great for the brain. So I'll start people out with resveratrol, say 100 milligrams. Once someone's tolerating that, 100 milligrams twice a day. Then the next bottle, you get a 250 milligram size and take that once a day. Then go to 250 twice a day, and then to 500 milligrams twice a day.
So you go from 100 up to 500,
Twice
little
a day.
by little.
Yes. Well,
In what time?
Well,
A
the
week
time
or 3?
frame that I would use is going to be individualized. If someone tolerates it and they don't have any kind of a herx or die-off reaction, then they can ramp it up more quickly.
Okay.
But most people I might take a month to work that up, but it's going to depend on each individual's tolerance.
How you're feeling, yeah. Okay.
Yes. Now, if they're getting a lot of kill from the Japanese knotweed, then you might want to back off. Because if you get a lot of kill, you're toxin loading the system, and it's going to be hard for your immune system to function. You want that functioning. So you don't want to back up the sewers with too much kill. A little bit of kill is fine. A lot of kill is not a positive thing.
Of
So you
course.
back down until you're tolerating that, and then you gradually go back to increasing it. And for people that are ultra super sensitive, you can get Chinese skullcap and Japanese knotweed in a tincture and start with one drop in a glass of water and drink a third of the glass one day and another third or 2/3 the following day. So even for the people,
Wow.
many of whom that we see are super sensitive, they can use extra tiny microdoses. Or the resveratrol from Swanson comes in a 5 milligram dose, and everybody tolerates 5 milligrams. So that can be worked up slowly and gradually as per tolerance. So once I have the foundation support supplements, the Chinese skull cap that has someone feeling better with lowering inflammation, anxiety, insomnia, and then adding in the Japanese knotweed or resveratrol that lowers inflammation and helps the brain, then I'm typically ready for step 3. And what I've been using lately is something called methylene blue. Now, we have studies showing that methylene blue is highly effective in the treatment of chronic Bartonella, chronic Lyme, and even for Babesia. Methylene blue was originally a dye, and it was developed and used as a treatment for malaria in the late 1800s. So it actually works for Lyme, Bartonella, and Babesia, and you can obtain it over the counter without a prescription. So when you get it over the counter, it comes in a bottle of a 1% solution, and you want to use a USP grade, United States Pharmacopoeia.
Okay.
So that it's safe for human consumption. It's not to use for staining slides in the laboratory that might have contaminants that you don't want to be consuming. You can get it on Amazon. You can just type in methylene blue 1% USP on your search engine. It contains a 0.5 milligram per drop. So the doses that we typically use to treat Lyme and Bartonella and Babesia are 25 to 50 milligrams twice a day. But the doses that methylene blue helps other things for are 10 to 20 milligrams a day, or 10 to 20 drops twice a day. So just like the Chinese skullcap and Japanese knotweed or resveratrol, methylene blue is a fabulous help for mitochondrial dysfunction. It helps people with Lyme feel better. Everybody with Lyme is tired. So methylene blue actually supplies additional electrons in the mitochondria to generate energy. So we start people with one drop twice a day, and then gradually over weeks or months, work up that dose of methylene blue. In low doses, you should see little, if any, herx. And sometimes people almost immediately feel better because it's stoking their mitochondria. Methylene blue has been used for Lyme, Bartonella, Babesia, chronic fatigue, fibromyalgia, autism, Parkinson's, Alzheimer's. So you can get a 30 or 50 ml bottle for about $30. So it's not expensive. Now you can obtain it in a prescription form. I did find on Amazon for $70, you could get powdered methylene blue enough to make 500 mLs. So that's going to be very inexpensive and last a long time, even if someone ramps the doses up to that 25 to 50 milligrams twice a day. So
Twice a day.
20 to 50.
But not more than that.
You don't want to ramp it up above the regular doses because people can get too much kill. It isn't a virtue to make yourself sick from too much kill. you want to have a balance between the amount of kill and still having your body in a situation where it can function
And recover.
do what it needs to do. So you've got to listen to how your body is responding. And a little bit of kill and some good days is what you should be looking for. And then once you're doing better, then you can try to ramp that dose up. If it's too much kill, you've got to back off. So once we have the support supplements, the Chinese skull cap, the resveratrol, or the Japanese knotweed, and the methylene blue, we're just feeling better. So now we're in a position where we can tolerate heavier duty kill. So the herbal that worked the best for kill of Lyme, the best for chronic persistent Bartonella, the best for chronic persistent Babesia is Cryptolepis. So now we're ready for Cryptolepis. So that really only comes in tinctures. And of course, you're going to be starting out with 1 drop or 1 drop twice a day and then work your way up. Now, that you want to work up slowly because you're going to get big kill with Cryptolepis. So most people work their way up to, if they're super sensitive, 5 to 10 drops twice a day, or if they have like normal sensitivity, 15 or maybe as much as 30 drops twice a day. And you're going to get kill on Cryptolepis. So again, do not push it too hard. Read how your body is doing and work that up gradually. Now, if someone is working with a Lyme literate physician, some of the other big guns that can be used are traditional antibiotics, Dapsone, disulfiram, and you can get methylene blue in a prescription. Methylene blue is available without having to compound it in Canada. So I've used Scripps Pharmacy, and you can get 100 of the 50 milligram methylene blue for $100, which is much less expensive than you're going to pay when it has to be compounded. So, I love the idea that the research has been done by funding from the Lyme advocacy groups so that we know what herbals work for Lyme, Bartonella, and Babesia. We can construct regimens that anybody would be able to manage without a physician.
Or with the physician, but at least knowing what to do.
Perfectly fine to do it with a physician, but none of the things that I'm describing require a physician to prescribe them. So, that's a regimen that any layperson can manage on their own by being careful and cognizant of their body's response, adding things in slowly, a little at a time, and then gradually working their way up and then managing the whole regimen for at least 6 to 12 months. Now, one other addition that is probably worthwhile adding in is my favorite biofilm buster, and that's oil of oregano. So oil of oregano is great for breaking up biofilm, but it also kills Lyme, Bartonella, and Babesia. So typically I will use oil of oregano as like 1 capsule twice a day, and then that breaks up any biofilm that might allow the Lyme to hide. So you start with your support supplements. My favorite multivitamin is the Life Extension 2 per day, Core Omega for omega-3, vitamin C, 1 or 2,000 milligrams, 2 to 4 times a day, and liposomal glutathione from Boardroom Organics. Then we add in Chinese skull cap, working up slowly to 2 capsules or 15 drops twice a day. Then add in Japanese knotweed or resveratrol, working up to 500 to 1,000 milligrams twice a day. Then adding in methylene blue, 25 to 50 drops twice a day. Adding in Cryptolepis or any other big guns like Dapsone, disulfiram, antibiotics.
What do you think about ivermectin?
I love ivermectin.
Yeah.
It is fabulous as an antiparasitic. It's an excellent antiviral.